Good afternoon, everyone. Thank you for calling in today for our next edition of the EVV webinar series for Homecare GPS today. This is Megan Fournier with the Homecare Alliance in Massachusetts. Just wanted to go over a couple of details per usual. You are in mute only just for the sake of outside distractions, but questions will be addressed at the end. You can just type them into the questions box at any point in time during the webinar, and we will again address them at the end. And this is being recorded just like the other webinars and will be made available as soon as it's been processed, most likely later today. We do have a landing page for EVV, which includes information that you need just on the subject itself, including regulations and updates and everything, as well as all the recordings and websites for the EVV vendors that we are showcasing. I will make sure that you receive that link again in case you are unaware of where to find it. So with that, I'm now going to hand it over to Kim, who's going to do our presentation with Homecare GPS.
Good afternoon. My name is Kim Balil, and I'm the Director of Operations for Homecare GPS. We offer a home health care management software and service and are located locally in Worcester, Massachusetts. But first of all, I want to welcome you to today's EVV Showcase presentation and also extend a thank you to Megan Fournier and the Homecare Alliance of Massachusetts for this educational opportunity. Since prior vendor presentations have really provided significant details concerning the EVV regulations and implementation, so today I'm going to provide you with just a few key points that relate specifically to Massachusetts agencies. I will also give you a high-level overview of our product, Homecare GPS software, to provide a context of how our EVV solution would fit into the operations of your agency. We'll then close with a few important points to consider as you make a decision concerning how your agency will comply with the federal EVV mandate. Without further ado, EVV, which stands for Electronic Visit Verification, is simply a system that electronically verifies when a person receives services in the home or community. The reason this whole effort is being done is to ensure service delivery to members, to transition to a paperless solution, and of course, to decrease billing errors and unauthorized spending. The federal law called the 21st Century Cures Act requires all home care providers that receive federal funds and provide personal care services to be compliant with the mandate by January 1st of 2020. That's in only 7 months' time. Certified agencies have until January 1st of 2023 to comply. Why is this not moving? Okay. Fortunately, Massachusetts agencies are allowed to choose their own EVV solution, one option of which is the time tracking application that the state is developing called My Timesheet. The My Timesheet application will be free of cost to agencies and consumers to use and will meet the EVV requirements. Of course, it's only a time tracking solution and it's not fully integrated with other visit data, your billing, or payroll. The beautiful thing is that in Massachusetts, you may choose any system that works for you so long as it verifies the basic visit data I have listed here, essentially the who, what, when, and where of the visit. These will then need to be transmitted to the state's data aggregator system that combines and manages all this data for them. More information can be found at the URL listed here, or you can email other questions to the state at the email address listed here as well. Now, I'd like to shed a little light at the end of the tunnel. Agencies who have implemented EVV already have found benefits with more accurate and timely visit documentation, which is a great benefit to all agencies. This is particularly true for solutions that combine the EVV with the visit note completion as one whole system, so only one system is used to fully complete the visit note. So, what is Homecare GPS? Homecare GPS is a secure, web-based home health care management software and service designed to improve an agency's compliance, efficiency, and profitability. Our software includes 3 main modules: a human resource module, a clinical module, and a revenue management module. We are really ideal for any kind of home health care agency type, whether you're a VNA, group adult foster care, ASAP providers, or even private duty agencies. And what really sets us apart, there's quite a few things actually. But first of all, Homecare GPS has been designed out of industry experience. We're a local software and service company with a deep understanding of the regulatory and operational needs that Massachusetts home health agencies face, and we're dedicated to delivering value to our clients in the areas of compliance, efficiency, and profitability. We put tremendous care and attention into simplifying the complexities of the back office operations, not just the field staff, but the back office operations that are so important and to function, and also your compliance efforts. We have automated many otherwise time-consuming manual efforts to perform things like eligibility checks, OIG checking, billing and payment tracking, or even calculating mileage for payroll. Secondly, we recognize that no 2 agencies are alike, so we've built into our software a great deal of customization and flexibility to support different agencies' policies, procedures, and workflow. And lastly, our software is easy to use both from an administrative side as well as the field side. We also believe in the importance of local training and software support to help agencies be successful. After all, their success is our success. So as a result, we tend to provide a higher level of training and support to get agencies up and running, because we know change is difficult, change is hard, but we really try to make that easy for all the agencies that we engage with. All of these things go into our software design, and for the past 7 years, we've been satisfying the needs of both very large and very small agencies. So Homecare GPS has 3 main modules that we spoke of: the HR module, the clinical module, and revenue management. In our HR module is where you manage your staff onboarding, in-service training, OIG checking, and payroll. In the clinical module, you'll find the scheduler, all the point of care documentation, which of course is where our EVV solution is, and the QA function. Our revenue management module, which includes daily MassHealth eligibility checks, a prior auth tracking feature, a pre-bill compliance checklist, batch billing, and claim payment tracking. So Homecare GPS software and service is available in a few different ways. Depending upon your needs, you may subscribe to only 1, 2, or all 3 modules, making it a full EMR solution for you. We also offer 2 key compliance features as stand-alone options, if that's all an agency needs at the moment. Those include the daily MassHealth eligibility checking and the monthly OIG checking of employees. These help keep agencies compliant in simple but really important ways. So let's go into a little bit more detail of each module. Let's start with our human resources module. Every agency needs to onboard staff, manage expiring documents, and conduct annual in-service trainings, and most of them need to perform monthly OIG checks. All of this is managed in our HR module. For onboarding documentation, we customize the list of your agency's required pre-hire and hire documents and the annual in-service trainings that get applied to each employee's profile based on their discipline. We have a library of electronic forms that can be used for the employee to complete, either using the mobile app that we have or on a computer. They can even use the mobile app to upload and submit a photo of a new license or other document, and that's a really convenient feature. Your HR coordinator will then check off each item once they're verified as completed and compliant, and anything left needs to get managed. Any expiration dates for licenses or health assessments are captured during this process so that they can stay on top of them. We also create a simple badge template for you that prints out of normal printer paper and inserts into a vertical lanyard. In addition to showing any electronic forms completed, any external documents can be uploaded to appear in the employee's electronic document binder for easy reference. The binder has different files in it, some of which are protected by security permissions granted by the agency based on their employee's job need. That would be, for instance, the CORI, I-9, or medical document. Homecare GPS hosts an online library of in-service trainings, many of which are available in both English and Spanish. Your staff may complete these at their convenience, either using our mobile app or logging into their GPS account. Each in-service contains reading material and an online test that is automatically graded. You can even print out a certificate at the click of a button for them. To help your agency be compliant, Homecare GPS will run monthly OIG checks on your active staff and agency doctor listings. This is a requirement of any agency that receives monies from federal or state government agencies. When the state performed audits this past season, they discovered that most agencies were not compliant in this area. This is one of the features that we offer as a standalone item just because it's very convenient and helps agencies remain compliant in that area. Now, your HR coordinator will use the report filters in our software to track and manage any expiring or overdue documents and in-services. And then we have built-in communication tools they'll use to text or email your staff to let them know that these items are needed. Your staff can then use the app to complete them or upload new documents to send you, which is, again, a really convenient feature. No longer having to run back and forth to the office to bring documents, you can actually just send them in. Permissions to the software are assigned by the agency based on job need, and by default, all users have access only to their dashboard to view only their HR or clinical tasks. The last main feature in the Human Resources module is Payroll. The Payroll feature in Homecare GPS is a very flexible tool. It simplifies the payroll processing into just a few easy steps. If an agency uses an external EMR like Access or Kinzer, then they would be able to use a visit import feature to bring in visits from that EMR. Otherwise, the visits are already in GPS, ready to be rolled into the payroll. The Payroll feature can handle proper calculation of overtime, mileage calculation, reimbursements, meetings, holiday pay, PTO accrual, and just many more features. There's a great deal of customization available to meet your agency's very specific policies. In the end, the Payroll module will generate an Excel file that you can submit to your payroll company. We have a lot of different templates available, but if needed, we can customize that export file to meet your specific payroll company's requirements. So now to move on to our clinical module. The clinical module is where all the patient care is managed. It contains the patient profiles, the scheduler, the Hha Care Plans, point of care documentation, including our EVV solution, the QA and approval, and our central task list. Now, the patient profile has a lot of features and can be used as simply or as deeply as you choose. Besides basic patient demographics, It has a referral management component. You can list the episodes, track MD orders and related billing data. You can upload patient documents like the MDS, admission paperwork, or other things. And you can track medications and allergies, contacts, facilities, hospitalizations, and service holds, just a lot of different things it can track. You can also keep track of the leave of absences, the non-medical or medical leave of absence units, and all of that ties into the billing. Now, the patient scheduler is where you schedule all of the visits and clinical tasks. Once scheduled, each visit or task will appear on the staff's clinical dashboard to complete. There's a lot of flexible scheduling options, making it easy to schedule out the whole episode. And should your staff change, it's really easy to reassign visits by day, by week, or even for the rest of the episode. The scheduler allows you to schedule split visits where, for instance, a single visit will include, home health aid, homemaking, and PCA services. All of those services are completed in a single visit with the amount of time allotted to each service according to the schedule, and it flows right into billing and payroll so that you get the right codes, units, and rates. The HHA care plans are created, one specifically for each patient. It contains only those tasks that are to be performed along with other settings. What this does is ensures that all your visit notes are compliant every time and saves a tremendous amount of time during the QA and approval process. So it doesn't provide a list of everything possible, it only provides a list in those visit notes that patient needs done. For our point of care documentation, we have a library of standard clinical forms that can be completed electronically, moving you away from the hassle of paper documents. Our MDS form can be exported as a file for import into the Harmony system, and that alone saves tremendous time and administrative errors in hand typing. You can use our standard e-forms or order custom forms to be developed for you. Our e-forms can be completed using commonly owned electronic devices. The assigned clinical task can be completed on an iPad, a tablet, or computer. And HHA visit notes may be completed using our mobile app with EVV, our IVR system using either a simple or smartphone that has SMS and phone capability, or a computer. Now, for our EVV solution, our primary solution is in our mobile app. It's available for both Android and Apple mobile devices. The app is very easy to use and very convenient tool for your field staff to complete both visit notes and to do HR in-service trainings, as I had mentioned earlier. Using the app, your aides can check their schedule for today or next week. They can view and complete any past due or returned visit notes. And for each visit, they can see patient contact information, see the address on a map. They always communicates the expected visit duration, and they can view all of the care plan tasks that need to be completed during their visit. Now, the app will capture their location at clock in and clock out times, and it can do a location ping during the expected visit duration. The nice thing is a notification can be sent to remind them if they forget to clock out at the expected time. Now, their location is analyzed. It's relative to a geofence criteria, and if it falls outside of an acceptable range, then the system will still allow the aide to continue using the system, to complete their visit and stuff, but the variance will be reported to you. This helps keep your operations moving forward, but provides you with the data that you need to manage your patient care. Upon completion of a visit note, there's built-in validation that ensures it's compliant with tasks being done and checked, and that it meets the expected duration. Now, in the event that the visit duration falls outside of what is expected for that particular visit, then it requires the staff to enter in a note to the supervisor explaining why. And that just helps during the QA process, the QA and approval process. They don't have to get on a phone to contact them. The information is available right there. The app allows the patient's signature to be captured, and it will store the location, date, and time of the capture. Now, if the patient is unable to sign, then a representative can sign on their behalf, noting their name and relationship to the patient. And that just verifies that the patient is doing this at the time of the visit. Now, in the event that an aide is unable to use a mobile device to complete the visit using the app, then there is an alternative EVV option for them. They can use the patient's phone to call into our IVR system, and that's an interactive voice recognition system to clock in and clock out and to complete their visit note. Now, on the back end, there's a few key features to help you manage patient care. One is a geofence variance report that helps you to analyze and manage visit location exceptions with the quick visual indicators. Also, I had mentioned notifications. When an aide has not clocked in for a visit within a reasonable time, that then gives you the opportunity to reassign that service if needed. And then the third thing is we have what we call Map Assist, and this is the ability to use the addresses, the home addresses of patients and staff to assist with scheduling. For instance, you can enter in a patient or a zip code and see the patients and or the staff that live within a given radius of that zip code. Now, there's a few additional features I'd like to cover that help with the clinical quality management. One is most notes are QA'd using a batch process with built-in validation to highlight only those exceptions that need your review and attention. If you can override and approve some of the variances, or you can send it back to the clinician for them to fix. And that note will appear on their dashboard for them to finish or on the app. Our central task list, this is a communication tool that helps manage patient care-related tasks assigned to either a department or an employee, and it tracks their completion. And lastly, a central matrix report will indicate variances between doctors' orders, authorizations, and scheduled visits. If all of these things are lined up, that's good, but it'll highlight where there's exceptions to that. So now to go over our revenue management module. The revenue management module in Homecare GPS is designed to protect your revenue while delivering significant efficiencies with otherwise time-consuming manual efforts. Its features essentially check that your patients are eligible, that your services are authorized, documented, billed, and paid. The system performs daily Mass Health eligibility checks, reporting on patients with no coverage or changed plans. This ensures your compliance with Mass Health regulations, which require you to do them daily, and allows you to proactively deal with any insurance issues. And the best thing is it only takes a minute or two to view the results each day. The prior auth tracking feature logs your approved authorizations and tracks when the next ones are due, and that helps prevent gaps in service authorizations. This feature ties into billing by splitting the claims by prior auth period or holding the visits until the approved authorization is in place. And then the pre-bill compliance checklist helps ensure that payers' requirements for clinical documentation is in place prior to billing an episode. And that would be things like the face-to-face, the 45, their eligibility criteria is confirmed, ABN notices, just different things, all the many documents payers have requirements that they be in place, certain things prior to billing. And billing is a snap through our system. You can electronically submit institutional or professional claims to Mass Health, MCOs, or Medicare, and even create invoices for private pay patients. If you are a VNA in Massachusetts and receive TPL demand bill letters from Mass Health twice a year, then you can submit the TPL claims through Homecare GPS and use the tools in our software to manage each episode involved through to completion. It's a fairly lengthy process, but ensures that you do it correctly. If you're a VNA that uses a different EMR, such as Access or Kinzer, you can still use our system for billing. We have a visit import feature that allows you to import your visits and easily prepare them for billing and payroll through GPS. And I had mentioned that in the payroll area as well. Once the visits are in our system, they're eligible for billing and payroll. So it's very easy to gain value out of both of those features with the visits in our system. Each claims payment is tracked until it is reconciled in full. We receive Mass Health payment status just a few hours after claim submission, and our system will also import the 835 files to log payments from MCOs. So overall, the billing function can take just a few hours a week, really frees staff up to do other things. Using Homecare GPS, we've seen one agency use a single biller to handle all of the billing activity for over 500 patients, and that includes their TPL billing projects. That's pretty significant. We've also taught several agencies how to do their billing so they can bring that billing function in-house at tremendous cost savings. Okay, so you've now had a high-level overview of the different modules and get a feel for what we're about. There's really so much that Homecare GPS has to offer. You'll find value at even the most basic levels, and the more you utilize the depth of its features, you gain that much more value. The key thing is our software is designed by experience. We offer a higher touch software service and are dedicated to bringing value to our clients in the areas of compliance, efficiency, and profitability. We have flexible and customizable options to meet your agency's specific needs, whether you use the full EMR, one or even two modules, or even just a few standalone features to start with. Our mobile app with EVV works with both Android and Apple mobile devices, and a really simple solution to implement with your field staff. This is a really big decision that many agencies have to make and implement over the next 7 months. I want to leave you with a few key considerations as you decide on the right solution for your agency to fulfill the EVV mandate. First of all is fit. You want to find the right level of integration. Do you just want a time tracker and manage the rest of your task completion in other ways? What all do you want? Or do you want a fully integrated system, which would perhaps be much more efficient? What level of customization do you need? You want something that's simple for your agency to implement and has the right degree of support to meet your agency. Second of all is future. You want to find a solution that will provide, as I kind of look at, the most bang for your change efforts, the most benefit for your agency in the long run. Is it flexible enough to handle the changes in the industry? And is it flexible enough to meet your agency's future vision? You know, you implement an EMR at this time, you want to make sure that it's going to be able to grow with you as you grow. And lastly is timing. You want to allow a buffer of time to get your agency set up, trained, and everything implemented. And not just your administrative staff trained, your field staff trained. Generally, that may take about 3 months' time, depending upon the choice of your solution. I do not recommend procrastinating this decision because a lot of people do procrastinate, end up last minute trying to huff through things. But the best thing you can do is make a thoughtful decision, best during the summer, so that you are fully implemented during Q4 of this year and ready to go with fulfilling that EVV mandate by January 1st. If you have any questions or would like to schedule a discussion or demonstration between us and your agency, or to see how we may be a fit for you, feel free to reach us at the information, the email and phone numbers listed here. You can also visit our website at homecaregps.com. I've listed our general contact information as well as my own. And at this time, I've kind of given you the overview, but I have my colleague, James Drogi, here with me, and we'll be happy to answer any questions that people may have.
Thank you so much, Kim. So we do actually have one question currently. A reminder, if you do have any questions, you can write it into the questions tab, which is in the sidebar. So in Massachusetts, elder referral agencies, or ASAPs, pay for many of the non-certified aid visits. Provider Direct is the state system which we must bill using CSV files. Does your software allow for eligibility checks to Provider Direct similar to the process for MH eligibility? Is your system able to create a file for billing via CSV? And is your system currently interfacing with NetSmart or Medtech? That was long, so let me know if you need me to repeat it.
Yeah. Do you have a way of sending me that message?
Yes. Let's see. Give me 1 second. I'll just make sure that you can see it.
So, the math question? Yeah. If you use the POSC for getting all of your eligibility data, then our system will be able to capture that for you.
And Kim, check in your chat box that has the full question available to it.
Good question. Pay for Provider Direct CSV. So don't they? Yeah, we actually, I did want to make mention of something here. We have, I'm kind of going to start at the bottom and work our way up here. Our eligibility checking for Mass Health is done behind the scenes, but through the POSC. The billing, we have the ability to bill, we utilize a different company that utilizes a bunch of different companies to bill. Anyone that can do electronic billing will bill through our vendor that we utilize. And so they would use Medtech or NetSmart. We just go to them as a collective vendor. James, did you want to give this a minute?
All right, this is James. I just wanted to add to the ASAP portion of the question. We do offer a CSV file that's formatted according to the ASAP's requirements. Usually the ASAPs will give you a list of patients and the approved hours, and you have to match them and then submit the CSV back to them. So we actually take that in, absorb all the approved authorizations, and we then use that to track how you're scheduling. So once you have that spreadsheet available, we take that into our system, and then when you do the bill, the claim is actually that CSV back that you can then submit back to them. So that's taking care of the billing option. So the NetStart and Medtech, I believe that has to do with HL7 message exchange. We do have capability to implement that, but that's usually at the specific agency level because every what they call message is unique. So you already have that specification. We could definitely do that as a customization for your specific agency. So I don't know if there are any clarifications to that. If we touch on everything, I'll clarify it as needed.
Great. And does anyone else have any other questions? And Kim, do you have any final thoughts that you wanted to add?
No, the best thing that we do upon implementation, when an agency, expressed interest in saying, hey, this might be a solution for us, it's really important for us that we meet and understand what their needs are and what their workflow is and where value we see can be added. And that discussion is really important. And that's how, not like an off-the-shelf, we really work to understand that we're going to be bringing value to an agency and work how the system would be customized to meet their needs. So just wanted to put that out there, that it's a lot of discussion, simple discussion, but there's discussion to really understand what their needs are. And love to see when our clients, they find value in so many different ways. I can share a lot of different stories about that, but the nice thing is we try to keep it simple. And when it comes down to an EVV, especially in a predominantly paper-full industry, because a lot of the needs of this industry have gone largely unmet. So the fact that we have a solution for an electronic solution that would be easy to implement with field, our app is super easy, and that makes it a lot easier for the agency administrative staff to implement something when it's easy for their field staff to adopt it. And so that's just an important piece. But we're really just happy to be here, and just want to thank for that opportunity, and happy to answer any questions that people have. They can contact us at any point here. And on our website is a place where you can also submit a request for a demonstration, just contact information through there as well.
Well, thank you so much, Kim. We really appreciate it. And obviously, your information will be put out to everyone that was able to listen today. And so I hope everyone has a wonderful rest of the day, and you will gain access to the recording shortly. If you have any questions, again, you can send them to me, or you can send them to Kim if it's directly about Homecare GPS. And I hope that you're able to call into our next session.
Great. Thank you so much, Megan.
Thank you.
Bye-bye.